digestible and indigestible. If cellulose is digestible, it should be processed by enzymes and absorbed by intestines. So normally it is absent in the feces. If there is abnormal digestion of carbohydrates, digestible cellulose will happen in the feces. Indigestible cellulose is normal component. One more carbohydrate is starch. Starch normally is absent. If starch or digestible vegetable cellulose is present, it is abnormal digestion of the carbohydrate. This symptom is named amyloreia. Remember this word, amyloreia. Next food component which we can meet in the feces is muscular fibers. Muscular fibers can be of two types: digested and indigested. Digested fibers, in other words, are fibers without striated pattern. Undigested fibers are fibers with striated pattern. If there are enzymes which can process proteins, striated patterns from the muscular fibers have to disappear. If undigested muscular fibers are present in the stool, it is abnormal case. It is abnormal digestion of the proteins. This symptom is named creatorrhea. So creatorrhea is abnormal digestion of the proteins. Next symptom which we can meet is abnormal digestion of fats. Fats can have different types. It can be fats itself, it can be fatty acids, and also it can be soaps. What is soap according to a chemical structure? Biochemistry. What is soap? Salt of fatty acids. So fatty acids can take a structure of soap. So if you will find fatty acids, salts of fatty acids, or fats itself, it is abnormal digestion of fats. This symptom is named steatorrhea. So, these are symptoms of the abnormal digestion. There are two syndromes which we can find. Two syndromes of the abnormal digestion. They are fermentative dyspepsia and putrid dyspepsia. Fermentative or enzymatic dyspepsia is dyspepsia which is caused by abnormal digestion of the carbohydrates. What can we see in this case? We can see liquid or semi-liquid stool, acidic smell, acidic reaction, and amyloreia. If we will find combinations of these symptoms, it is fermentative dyspepsia. Second case is putrid dyspepsia. We can find liquid or semi-liquid stool, putrid smell, alkaline pH, and creatorrhea. If we will find these combinations, you should conclude putrid dyspepsia. Next case which we can meet is mechanical jaundice. Mechanical jaundice characterized by absence of stercobilin in stool. Because of absence of stercobilin, stool is colorless. And also because of abnormal extraction of bile, fats will not be digested well. That's why steatorrhea will be present. So colorless or pale feces plus steatorrhea. It is mechanical jaundice. Also, by microscopy, we can find two possible diseases, two possible syndromes, enteritis and colitis. Enteritis characterized by liquid stool. Stool can be foamy. By microscopy, we can find WBC and sometimes a little bit of mucus. Mucus looks like a foam. Colitis case. Stool is liquid or semi-liquid, there is diarrhea. Stool can be mixed with the blood. By microscopy, we can see WBC and a lot of mucus or RBC. So WBC plus mucus is colitis, WBC plus RBC is colitis too. Enteritis mostly caused by viruses. That's why RBC are absent. Mucus is not extracted a lot. Sorry? Алло. Да. Да. So, enteritis is caused by viruses. Why? Only WBC react in enteritis. The most possible reason of colitis, the most frequent reason, is bacteria. From the microbiology, you have to know that all bacteria which cause colitis, Escherichia coli, Shigella, Salmonella, and another bacteria are invasive bacteria. They invade to mucosa of the colon. Because of invasion, they lead to destruction of the epithelium, and RBC will go to the feces. If bacteria is non-invasive, colon epithelium produce a lot of mucus as a protection. That's why mucus will happen in these cases. So mucus and or RBC plus WBC. It is colitis. So colitis characterized by bleeding also. And also by this test we can find hemorrhage from the GI tract. From the first GI system lesson, you have to know that hemorrhage can be of two types. Hemorrhage from the upper level of the GI tract and lower level. In the feces, bleeding from the upper level of GI tract looks like a black color of feces. Symptom is named melena. Hidden blood test is positive, and RBC are present in the microscope. Melena, hidden blood test plus RBC. It is hemorrhage from the upper level. Hemorrhage from the lower level of GI tract system. There is red blood in the feces. Feces are mixed with the blood. By chemical test, we can find hidden blood test, which is positive. And by microscopy, we can find RBC. And third case, bleeding from the rectum. Rectal bleeding characterized by blood on the surface of feces in the end of defecation. Hidden blood test is positive, RBC in the microscopy. Remember, colitis is one of the reasons of the bleeding. So patients with colitis have a bleeding if RBC are present. So it can be colitis. If WBC are not increased and there is blood in the stool, we need to search for cancer, first of all. Also, parasites can be a reason of the infection. To confirm parasites, we can find helminths, eggs, or protozoa invasion. If we found them, so we can confirm parasitic infection. Presence of parasite does not exclude cancer. So we need to do examination for presence of cancer anyway. Presence of colitis does not exclude cancer. So only by this test we cannot confirm cancer, but we can suspect it if there is bleeding. That's it. Is this test clear? So, symptoms of the abnormal digestion, syndromes of the abnormal digestion, syndrome of colitis, enteritis, and hemorrhage from the upper and lower level of the GI tract, and mechanical jaundice. These conclusions are possible. Is it clear? Okay, next test is biochemical blood test.